This is kind of a nice story to some extent because it's got a very happy ending. Imagine waking up every morning, looking down, and watching your abdomen get larger every week. People begin asking, am I gaining weight? Am I okay? Why does my stomach look swollen? But deep inside, something isn't right. And then one day, you have a tumor the size of a basketball. For many cancers, that sounds terrifying, but today's story is different because one pill can completely change a person's future. That's why I'm so excited to share the story of Michael with you. My name is Alex Ehsan. I'm a medical oncologist and a hematologist. And I'd like to share with you a remarkable success story in modern cancer medicine. The name of the tumor is gastrointestinal stromal tumor, or GIST, G-I-S-T. So let's meet Michael. 61-year-old gentleman, quite healthy. He noticed his pants weren't fitting him, and yet he wasn't gaining weight. His abdomen was getting larger and larger, and he was eating less and less. His wife used to tell me, Dr. Ehsan, I made him his favorite chicken pot pie, and he ate a couple of spoons of it and he was done. One afternoon, he had developed severe abdominal pain. He went to the emergency room. They did a CAT scan, and they found a 10-inch tumor, or maybe a little bit bigger, cancer in the middle of his abdomen. It pushed on his intestine, his liver, his kidneys. He saw a very nice surgeon that I trust, and he point blank said, Michael, this is not safe to remove yet. You got to go see Alex, Dr. Ehsan, and we'll decide if he can shrink it a little before we operate on it. And surgery truly wasn't possible. So what is gastrointestinal stromal tumor? Fortunately, the biopsy can clearly give us an answer. It's not colon cancer, it's not stomach cancer, it's not lymphoma. It's a rare cancer that develops from a specialized cell in the wall of the digestive tract called interstitial cells of Cajal, or Cajal, C-A-J-A-L. And these cells that help coordinate the movement of food through the gastrointestinal tract. They basically move your food from one side to the other. And some of these cells appear, as you would expect, in the esophagus, in the colon, in the rectum, and other parts of the abdomen. They generally need to be tested for a couple of mutations. One of them is called KIT, and one of them is called PDGFRA. And I'm certain if I'm your doctor, I'm taking care of it. If not, your oncologist most definitely is doing that for you. Therefore, these mutations act like a light switch that gets stuck in the on position, and they don't stop. And so the tumor keeps getting bigger and bigger and bigger, hence the basketball concept. Now, 25 years ago, Michael would have had no options or very few options. Now we have pills. The pill I ended up giving him was called Imatinib. The commercial name is Gleevec. It's a targeted therapy that he took that literally goes to the light switch and turns it off. And Michael started taking his pill, and interestingly enough, he did not end up in the hospital, didn't lose his hair, and a few weeks later, he told me that he felt that he was eating more and he was able to finish an entire meal again. About 3 months later, we repeated a CAT scan that showed dramatic shrinkage. 6 months later, it was half as big as what it was before. I called up his surgeon. It was a proud moment. And he said, yes, I can remove it. So, in a nutshell, not every gastrointestinal tumor behaves exactly the same. Before starting treatment, it's very important that molecular testing is done, and this is not rocket science. We do it on everybody. Some tumors have the PDGFRA mutation. Some have the KIT mutation. But remember, one size does not fit all. And even though Imatinib was an excellent choice in this case, we now have at least 4 other drugs that are used. One is called sunitinib, regorafenib, ripretinib, and or what I call avapritinib. Really difficult names. I don't know why they have to make them like that. But the beauty of it is that every year we have a new drug. One of the greatest lessons that I learned was never to lose hope, especially even if you have a basketball in your belly that's not a kid or a baby, especially in a man. My patient went back to work, was able to hang out with his grandchildren and teach them how to play tennis. And my final message, and the reason I did this, is because gastrointestinal tumor is rare, but it's a success story. Believe it or not, we need all the success stories in oncology we can get. Patients end up having very meaningful lives after this. If this is something that can help you, or if you have a friend that needs to have his basketball checked out, definitely speak to your doctor. If you're one of my patients, I look forward to seeing you soon with another scan to make sure it's gone or it stays gone. And if you're not my patient, I hope you have the luxury and the pleasure of never being my patient. I wish you the best of luck. I'm going to type this up and make it sound scientific, and hopefully this can help somebody.